Hello students, this is lesson 21.2, Tools for Healthy Nutrition and Nutritional Therapy. My Plate. So this is a nutritional guide that is available at www.choosemyplate.gov. It is a food circle with a plate and glass divided into 5 food groups. And this helps to encourage Americans to include these specific proportions of these food groups on their plate every time they eat. So, one big section here is vegetables and then fruits. So half of the plate should consist of fruits and vegetables, with the amount of vegetables being a bit more than the amount of fruits, right? Because we learned about sugars, which naturally occur in fruit, so we want to limit those amounts and consume a bit more vegetables than fruit. Protein should be about a quarter of the plate, and grains should be about a quarter of the plate. There should be 1 serving of dairy with each meal, and so there's different ways to get that serving, right? It could be a glass of milk, or a yogurt, or a serving size of cheese. There's lots of different ways. And this helps to avoid any oversized portions, which is the most important message of My Plate. So the 2015 Dietary Guidelines for Americans work with My Plate to provide recommendations that support sound or good nutrition. So this is for anyone over the age of 2, and then those at risk for chronic disease. And the guidelines get updated every 5 years. So we're probably behind a little bit, right? This curriculum was published in 2018, so there would actually be 2020 guidelines that we probably should look at after we're finished with this lecture. Anyway, the 2015 guidelines focus on achieving and maintaining a healthy eating pattern, and they want people to pay attention to their caloric limits and also obtain regular physical activity. If they follow this eating pattern, it's more predictive of overall health status than actual individual nutrients is. Food labeling. So this is required by the FDA, the Food and Drug Administration. It is mandatory for packaged foods, and it's voluntary for raw produce. And the labeling is to provide consumers with accurate information about the nutrients and the ingredients in that food. So this would include the common name of the product, name and address of manufacturer, packer, or distributor, the net quantity of contents in terms of their weight, measure, or count inside the package, how many of them, and then also the nutrient contents, so the nutrition facts panel. And then it will list the ingredients in descending order of predominance by weight. So the very first ingredient will be the one that is in the largest amount, and then the last ingredient will be the smallest. So descending, right, from largest to smallest. Okay, so let's look at those again. So here we have our serving size and then the servings per package, right? So that's actually really important to notice. A lot of people will say, oh, well, 1 serving is only 250 calories, but then they'll eat the whole package or the whole box. Well, you have to look at how many times do you need to multiply that, right? So if there's 2 servings in this container and you consume the whole thing, then you're actually getting 500 calories, right? You're getting double these amounts because it's 2 servings. Then you have the amount of calories and the amount of calories from fat. This is, and then it breaks it down per the percent daily value. Right, so right here you can see that the percent daily values are based on a 2,000 calorie diet. So your dietary needs may actually they should be maybe higher than that or lower than that. And it just depends. Everybody has a little bit different caloric need depending on their lifestyle, how sedentary they are or not, right? So the more activities we are doing, the higher our daily caloric need would be. But they're basing this off of a 2,000, which is about average for Americans, right? So they're saying that if you are consuming 2,000 calories a day, 18% of it, you're getting this, whatever this was. Say it was cookies, right? There's 2 cookies in this container or package. There was 12 grams of fat, so that's 24, right? So that would give you double 18% of the total amount of fat that you should be eating for that day. I hope that makes sense. Okay, so here's the nutrients that should be limited right here are fat, total fat, saturated fat, trans fat, cholesterol, and sodium, right? These are the ones that we definitely want to make sure that we're limiting to a certain amount every day. Additional nutrients that should be obtained in adequate amounts, right? So carbohydrates, fiber, sugar, protein, and then vitamins and minerals. So those are all ones that we need for sure. The footnote on the daily values, right? So I kind of explained that, right? Based off of a 2,000 calorie day per day diet or 2,500 calories per day, maybe for somebody who's working out or pregnant or lactating, they need more calories every day. All right. Yeah, we looked at our additional nutrients. So, just to review, I probably covered all of this already. The serving size and servings per package, right? This indicates the size of one single serving. And a packaged food almost always contains more than one serving. The amount of calories, this can assist us in our weight management. And so we need to pay attention to the number of servings that we're consuming every day. The percent daily value, again, that's the percentage of a nutrient that's being provided in that single serving of food compared with what our requirements are for an entire day. And as I said, this is always going to be based off of a 2,000 calorie per day diet, as that's pretty much the average. The nutrients that should be limited, those are the ones that we know we need to limit because they can be connected to health problems if we consume them in unlimited quantities. And those are fat, cholesterol, and sodium. Nutrients that should be obtained in adequate amounts because they're essentially important to our health are vitamins A, vitamin C, calcium, and iron. The footnote with the daily values, again, that's going to include the minimum or maximum daily values for the key nutrients. Most are goals that we want to stay below, but the fiber is at the minimum level, so we can actually go above that daily value of fiber. And then the additional nutrients, the carbohydrates, they're going to be broken down into their simple and complex types. Sugar is included under simple. Remember, that's one of our simple carbs. And then protein. Most Americans consume more protein than they need. A lot of people put a lot of emphasis on protein and how important it is. And so now we're finding that people are actually consuming way more than they need. And we'll probably learn about this later on, but it can actually become quite problematic for our kidneys because our bodies need to break down all of that excess protein. So we'll learn about that more. And again, the ingredient list in descending order of weight, highest weight down to the lowest weight. So this can help make healthy food choices. So, for example, if you're avoiding sugar and trans fats, you're going to want to make sure you select minimally processed foods because anything that's been processed, it's gone through that chemical reaction where we now have trans fats in it. And then you can also quickly scan the ingredient list for any ingredient that you might have an allergy to or an intolerance to. All right. So here's an example of an ingredient list that's pretty short. Whole grain wheat, wheat bran, raisins, oat fiber, sugar, and sea salt. It's probably some sort of cereal or granola, yeah. Here's an example of an ingredient list that is pretty long, right? Here's our corn flour is the most, the ingredient with the most amount, right? Followed by high fructose corn syrup, which is just another way of saying some really bad sugar. Oat flour, brown sugar, partially hydrogenated vegetable oil, salt, sodium citrate, natural and artificial flavors, trisodium phosphate, fruit juice concentrate, malic acid, red 40, that's a dye, niacinamide, yellow 5, blue 1, some more dyes, not usually very good for you, thiamine, mononitrate, pyridoxine, hydrochloride, and then BHT. So I might think twice about eating that. So nutrition therapy. This is the application of the science of nutrition to promote optimal health and also to treat illness. It's really important for the medical treatment plan for managing certain diseases and conditions. And a registered dietitian is qualified to assess nutritional status of a patient and then recommend appropriate therapy. Now, you will get other qualified and licensed practitioners prescribing nutritional therapy as well, such as your cardiologist would probably prescribe you a specific diet if you have high blood pressure or if you have heart disease, right? So it doesn't have to come from a registered dietitian, but they can also often refer patients to RDs, registered dietitians, to have them assist in helping patients really come up with a good plan when they've been prescribed certain diets or nutritional therapy. We talked about this earlier. The medical assistant should have basic knowledge of nutrition, but we are not qualified to recommend any nutrition therapy because that's essentially a prescription, right? But we can definitely assist the providers and practitioners in helping to educate the patients once they have a prescribed nutritional therapy. So one of the conditions that would require nutritional therapy are weight management, so being overweight or obese. So they'll put together a set of practices and behaviors to help keep the person's weight at a healthy level. And it usually depends on the number of calories consumed compared with the number of calories used. So you'll hear people talk about calories in, calories out quite often. The commonly prescribed idea is that if you can create a deficit between the amount of calories coming in and the calories going out, that you should lose weight. So obesity is the accumulation of body fat to the extent where it may have an adverse effect on the individual's health and well-being. And it's one of the most common chronic health problems, especially in America. 69% of adults in the U.S. are overweight or obese, so that's a lot. It's associated with premature death. It's the leading cause of preventable death. And the primary cause of obesity is excessive food intake combined with a lack of physical exercise. It sounds so simple, right? You eat too much and you don't move enough, you're going to end up overweight and eventually obese. But it's not quite always that simple, right? So, treatment plan for obesity. The nutritional therapy would include the selection of an appropriate eating plan, setting firm but reasonable weight loss goals, so slow and steady, right? Not fast or quick. The goal would be no more than 1 to 2 pounds lost per week, because this is sustainable, and usually people have much more success long term in maintaining the weight loss if they lose it at a slow and steady rate. Again, I talked about that caloric deficit, right? So moderately reducing the number of calories coming in, so that more calories are used than are taken in. And it's important to choose a program that is medically proven and is best suited to the patient's needs. So we want to avoid the patient trying fad diets. We'll talk about some of those as well. Additionally, a physical exercise program, because this increases the number of calories burned, which helps contribute to that caloric deficit, which will result in loss of weight. Recommended would be 150 minutes of moderate intensity activity per week. So you could, the patient could decide that they can do 30 minutes at a time, right? And then you would divide that up. So 150 divided by 30 would be 5. So that means 5 days a week they're going to perform 30 minutes of moderate intensity activity, right? And then they could have 2 days off to rest. But 2 days a week, they should also engage in muscle strengthening exercises. So that could be on those days off, or they could add it on to the days that they're performing the moderate intensity activity. Another really important part of a treatment plan for obesity is behavior modification. So it's important to change the behaviors that contributed to the weight gain in the first place, right? So first, those behaviors have to be identified. And then the best thing to do is to then take steps to replace those specific behaviors with alternative, healthier behaviors that the individual can turn to, so that the weight loss can be maintained and sustained for long term, for hopefully the rest of their life. So another disease that requires a specific nutrition therapy is cardiovascular disease. This is the leading cause of death in the United States. Most common is atherosclerosis in the coronary arteries. So this is referred to as CAD, coronary artery disease. High total blood cholesterol is a risk factor. Actually, we'll talk about this probably in MA 125. But specifically, it's the bad cholesterol, right? Not the good cholesterol. The bad cholesterol, the LDL, low-density lipoprotein, that causes the plaque buildup of the atherosclerosis along the arterial walls. So the TLC, Therapeutic Life Changes Eating Plan, is a set of guidelines for a heart-healthy diet. It helps to reduce the intake of dietary cholesterol, reduce the intake of saturated fat, and then increase the intake of soluble fiber. Hypertension is the most common life-threatening disease in Americans. The incidence of hypertension has increased as a result of our aging population and then also our increased rate of obesity. So hypertension is chronic high blood pressure. This can cause severe damage to the heart, the brain, the kidneys, and the eyes. Extremely high blood pressure can also cause a stroke. The early detection and treatment can prevent hypertension and all of the associated complications that come along with it. The DASH eating plan, stands for Dietary Approaches to Stop Hypertension. So it's one of the first things that a provider will do once identifying hypertension in an individual. And it's important to note that that doesn't just mean that your patient came into the office one day and their blood pressure was high, it's a chronic, high blood pressure. It's not just one reading. So anyway, the DASH diet is an approach to healthy eating that really all individuals can follow. So some people who are pre-hypertensive would be prescribed this diet as well. So not only just those with hypertension, but people who have a family history of it, or their blood pressure is trending higher but not quite hypertensive yet, they can benefit from this as well. So it's a balanced diet that's low in saturated fat, low in total fat, low in cholesterol, and most importantly, low in sodium. It's going to be high in fruits and veg and whole grains, legumes, and low-fat dairy. So this diet can also help prevent obesity, osteoporosis, diabetes, cancer, heart disease, and stroke, because a lot of these are associated with hypertension as well. So sodium intake. We know for a fact that most Americans consume way too much sodium. This is particularly important for hypertensive individuals, so people with high blood pressure, to lower their sodium intake. Because the plasma in our blood consists primarily of water, decreasing in sodium results in decrease of blood volume, which is therefore less resistance or force of the blood against our arterial walls, right? So there's a lot of things that affect blood pressure, which is the force of the blood against the walls of the arteries, so the pressure, and one of them is volume. Another one is constriction, right? That atherosclerosis that we just talked about. So CAD and hypertension often tend to go together, because the atherosclerosis on the arterial walls is almost like if you're putting a kink in a hose, you're really increasing the pressure on the rest of the artery walls when you've got a significant narrowing in one place or multiple places. Diabetes. So this is a lifelong condition, basically in which the body is not able to use glucose for energy because of a problem with insulin, right? So remember, glucose is the best source of energy for our bodies. So this can develop when the body produces either no insulin or very little insulin, or when our bodies cannot effectively use the insulin that it does produce. So 26 million Americans have diabetes, and an additional 79 million are pre-diabetic. This is amazing. So what happens? So obviously not all of those 79 million are becoming full-on diabetics, right? So hopefully they're turning that around with diet and lifestyle modifications. Recall that there are two types of diabetes. There's type 1, where these people are insulin dependent, right? So that means that their bodies aren't creating any insulin usually. And then type 2, which is not insulin dependent, so it can be managed. Type 2 can be managed with other medications and diet, non-insulin medications. So type 1 is an autoimmune defect that actually destroys the insulin-producing cells inside the pancreas. That's where insulin is produced. And then the body can no longer produce its own insulin, and it must be administered by injection. Nutritional therapy for type 1 diabetes focuses on just maintaining a good, steady control of the blood glucose levels. And these individuals need to track the amount and the type of carbohydrates they're consuming. And the nutritional therapy usually includes the exchange list system, and then counting carbs, and the MyPlate example. So we'll look at the exchange list system. This organizes foods into 6 groups based on their carbohydrate, protein, and fat content. The exchange means a food serving, and the patient must have an individualized plan that specifies the number and type of exchanges for meals and snacks, and this will stabilize their blood glucose levels. So here you can see one serving here of each of these items contains about 15 grams of carbohydrates. So this is the suggested serving size of these fruit items. The carbohydrate counting method is more flexible than the exchange method, and the carbohydrate content of the food is measured in grams against the amount that is administered. So typically 1 unit of insulin helps to process or metabolize 15 grams of carbohydrate. So the patient must be able to calculate the carbohydrate content of every food that they consume, and they usually can find this on food labels or other nutritional sources, right? And then they have to keep track of how many carbohydrates they are consuming, and then they know how many units of insulin to administer themselves. The MyPlate method is the most basic. It's appropriate for those with a low literacy skills or those who are kind of mentally challenged or just aren't able to do the exchange or the carbohydrate counting. And remember, it consists of 50% fruits and veg, 25% protein, and then 25% starchy foods, which also includes starchy vegetables because those produce the highest insulin response. And keeping to 25% starch at every meal or snack helps to control the blood glucose levels. So this is counting as our carbohydrate. Type 2 diabetes is more likely to occur in those aging over 40 years of age, and the biggest risk factor is excess body weight. They may have insulin resistance, which means that their body still produces insulin but is not able to use it effectively. So the nutritional therapy for type 2 diabetes could include controlling portion sizes, limiting concentrated sweets, emphasizing low glycemic index foods. You'll hear this referred to as the GI for glycemic index. And then increasing soluble fiber and attaining a healthy weight and also maintaining it. So lactose intolerance, this is when the body is unable to fully digest the lactose, which is the specific type of sugar that occurs in milk. So this is caused by a deficiency of lactase in our bodies, which is an enzyme that's produced in the small intestine. So some people just don't have enough lactase being produced for them to be able to consume lactose without getting the following symptoms. Things like abdominal bloating and cramping, right? This is after consuming something with lactose in it. Flatulence, which is gas, diarrhea, borborygmy, which is gurgling or rumbling sounds in the abdomen, and then nausea. So here's some common foods that contain lactose, milk, ice cream, gelato, butter, cheese. And then you can get foods that have actually had the lactose portion removed from them. So lactate is where they're putting the milk through a chemical process to remove the lactose. So the nutritional therapy for lactose intolerance would be obviously to avoid or limit the foods that you consume that contain milk or milk products. Consuming with a meal also can help reduce symptoms. And then switching to one of those lactose-free products or substitutes or cultured milk products like yogurt. And then you can also take lactase enzyme supplements. So you basically just replace that lactase enzyme that your body's not producing by taking it in a supplemental, usually a pill form. Celiac disease. So this is an autoimmune disorder of the digestive tract where the immune system attacks gluten. So the villi are the finger-like extensions that line the small intestine and help to increase the surface area for increased absorption of nutrients into the bloodstream. And in people with celiac disease, gluten irritates the small intestine, which damages the villi. And then that results in decreased surface area for absorption and causes malabsorption of nutrients. So bad absorption, right? So this can actually be pretty serious. Then there's also non-celiac gluten sensitivities. So these are the people who just cannot tolerate gluten, but luckily for them, there's actually no damage to the villi of the small intestine. And it's estimated that 18 million Americans have non-celiac gluten sensitivity, which is 6 times the number of people who actually have true celiac disease. So any people in either of these categories are going to want to avoid all of these types of foods. Anything with noodles or pasta, bread, grain cereals, obviously cookies, beer, some fun stuff. And symptoms of gluten intolerance, the first ones can be similar to lactose intolerance, right? So abdominal bloating and flatulence, diarrhea, constipation, abdominal pain, but then also weight loss due to malabsorption of nutrients, headache, fatigue, joint pain, brain fog, depression, and this one's a funny one to me, foul-smelling stool. I don't know that any stool actually smells good, so I think that's kind of funny, but apparently it could smell worse than other people. So the nutritional therapy would be gluten-free foods, right? So excluding foods that contain wheat, barley, rye, or triticale. Eating these gluten-free foods, you could eat beans, nuts, seeds, eggs, meat, poultry, fish, seafood, fruits and vegetables, and dairy. So still plenty of good foods to get nutrients from. And then you can get gluten-free grains such as buckwheat, cornmeal, flax, quinoa, rice, soy, and then they can actually remove the gluten from oats. So you can replace these items. You can make cornmeal bread or bread with buckwheat instead of regular flour, wheat flour. So there's lots of ways to get around it. And then there are just plain old food allergies, right? So common ones are milk, eggs, wheat, fish and shellfish, soybeans, the tree nuts such as peanuts, and then cashews, pecans, walnuts, Brazil nuts, hazelnuts, almonds, and coconuts, strawberries, tomatoes, peppers. These are kind of common things that people can have allergic reactions to after consuming them. Symptoms of food allergies usually include a skin rash or hives, swelling and itching, wheezing, shortness of breath, difficulty swallowing, abdominal cramping and pain, nausea and vomiting, and diarrhea. So nutrition therapy, if there's a suspected food allergy, would first be to eliminate it, right? The elimination diet. So you remove the offending food, and that's really easy to do when an individual is allergic just to one or two foods. Another therapy would be the rotation diet. So this limits the number of times a food is ingested, which can lead to a gradual desensitization of that food. And this is used for mild to moderate food allergies, right? If you're getting anaphylaxis from something, you're probably not going to go with the rotation diet. But just some moderate or mild symptoms, rash, you could do this, and it can actually improve the allergy. And then denaturation, which is when they expose the food to heat, which can reduce or alter the chemical structure and then change it enough to where an individual could eat it. You can also take medications and supplements to suppress the allergic response, but that can often make the allergy worse over time. You can orally take in digestive enzymes, which help to break down the offending thing into smaller, less allergenic molecules. Antacids cause the blood pH to become more alkaline, which can relieve allergy symptoms. So taking, Tums or something like that. And then vitamin C and vitamin B5 actually are known to possibly assist in helping to control the allergic reactions to food allergies. So that concludes our last lecture for this week, and we'll see you next week.